Stalking is a prevalent issue. In the United States, nearly 1 in 3 women and 1 in 6 men experience stalking at some point in their lifetimes. Of the millions of stalking victims each year, 1 in 4 report feeling physically sick. Stalking is a pattern of behavior directed at a specific person that causes fear and/or substantial emotional distress. Most stalkers use multiple tactics to scare their victims. They may engage in surveillance, watching, tracking, or monitoring the victim in person or through technology. They may invade the victim's life with excessive contact, showing up in person and/or leaving signs they've been in the victim's space. Stalkers often intimidate their victims with direct and indirect threats to harm them and those that they love. And stalkers frequently interfere with their victims' lives through sabotage or attack, including physical violence. These unpredictable tactics and threats create a sense of anticipatory fear, waiting for the other shoe to drop. Anticipatory fear is particularly traumatic and has been found to be the greatest predictor of long-term mental health issues in survivors of war, torture, and natural disasters. Over time, chronic stress and fear literally rewire the brain. That feeling of being under threat increases vigilance and causes an imbalance of neural circuitry that can affect the entire body. Stalking survivors have higher rates of chronic headaches, vision issues including blindness, asthma, irritable bowel syndrome, and chronic pain than people who have not been stalked. Stalking victims are also more likely to develop chronic diseases, including arthritis, cancer, diabetes, and heart disease. 1 in 3 stalkers are physically violent towards their victims, and stalking often intersects with both intimate partner violence and sexual violence, with the same harms and injuries. The vast majority of stalking victims report psychological impacts, with higher rates of anxiety, substance abuse disorder, post-traumatic stress disorder, and suicidal ideation than people who are not stalked. Stalking is a public health issue, and healthcare settings can be entry points for survivors to get the support that they need. Learn more about stalking and how healthcare professionals can respond through the Vital Signs Project at stalkingawareness.org.